really, really excited for this panel because we've been talking all morning and digesting all of this great information, research, and science, and it feels a little overwhelming at times. I totally understand. And now we're going to talk about, really get some examples of amazing work that's going on in our states, in our communities, what people are doing to give you this information, to get you prepped and ready in your own work. So get your scripts for action ready. Get your notes for effective action ready. Take some notes, because I think in this panel you're going to get some really great ideas that you can take back into your own work. With that, I would love to introduce you to Heather Trim. Can you wave your hand, Heather? Heather has graciously agreed to be our moderator for this panel. Heather and I go way back from the time when she was at People for Puget Sound, and Heather is now working for an organization called FutureWise, does amazing work. So Heather, just going to turn it right over to you.
All right, well, thank you. So we have a large panel, 7 people. So I'm going to do introductions of everyone, just a couple of sentences. You have the bios, the full bios of the program. I'm not going to introduce the 2 speakers who have been on previous panels. And then we will go in order of what's in the program for a 5-minute presentation by each presenter. And I think they could all probably talk for 45 minutes or more about the incredible work they're doing. So we'll keep them to 5 minutes, sort of the elevator highlights. And then we'll do questions, and then in the questions more will come out. And we will have audience questions as well. So first I'd like to introduce Bob Gould, who's the first presenter as well. At UCSF, he's an associate adjunct professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences, and director of Health Professional Outreach and Education for the UCSF Program on Reproductive Health and the Environment. And very importantly for us, he's been associated with Physicians for Social Responsibility since 1989 and is the 2014 national president. An incredibly effective organization. Next, I'd like to introduce Lori Valeriano, who is sitting to his right. She's the executive director of the Washington Toxics Coalition, and if you haven't met Lori, she is a tour de force. I think she has single-handedly made Washington State. That's a positive. She has single-handedly, I think, made Washington State the leader, one of the leaders in toxics reductions in the United States, because we have passed so many bills first, which have then pushed the nation, and that is really because of Lori. Down the, let's see, I guess I'm right. Sorry, Lori. So to my immediate right is Tony Marthaler Anderson, who is a family nurse practitioner who practices at her clinic, Wellness to Wellness, a women's health and lifestyle medical clinic in Greenback, Washington. Yeah. And you've already met Peggy, who is down the way there. And the next person I'd like to introduce is Corey Colwell-Lipson, who is a licensed marriage and family therapist and clinical art therapist for couples and people who are transitioning into parenthood. And by the way, she is 3 from the end. She has now branched into writing and speaking and strategies for green solutions, and especially for helping the mom market be reached in various ways in terms of TV and book and all sorts of presentations. And down second from the end is Holly Davies, who works at the Washington Department of Ecology. And I always refer to her as the toxics guru. And that's because when people ask me questions about the 3 chemicals that she's worked on, which is lead, PAHs, and now PCBs, I always refer them to Holly, because she works officially on reducing toxic threats. So that's the persistent bioaccumulative and toxic chemicals, i.e. PBTs, and has worked on the 3 chemical action plans that we're doing in Washington State. And next week is the kickoff meeting for PCBs, which I'm sure she'll be speaking of. And then lastly, you've already met at the end, Dr. Susan Buchanan. So we'll start with Bob.
Okay. Hi, everyone. I'm really happy to be here with this wonderful panel. So I was going to talk a very, very little amount of time on and focusing on the committee opinion that Dr. Buchanan had mentioned early before that has come out from the American College of Obstetrics and Gynecology and the American Society of Reproductive Medicine this year. As a little bit of background, I inevitably go to my work with Physicians for Social Responsibility, because for many years PSR has partnered with the American Academy of Pediatrics, understanding the base that's always been there within the pediatric community for about 50 years of understanding the impacts of environmental health and public health in the practice of medicine, with the Green Book, for example, that the AAP has published dealing with environmental health. This is in contradistinction to the OBGYN community that doesn't have that type of background. Over the years, we worked on developing with AAP Pediatric Environmental Health Toolkit that has trained thousands of pediatricians to incorporate environmental health into their clinical practice. So in many ways, the committee opinion of ACOG represents a common sense approach. There's everything that we've talked about today about the lifetime impacts of prenatal exposures in terms of human health. We obviously would want to turn to energize and organize the OBGYN community. So this process of developing the ACOG statement, which I would underscore came out of the Committee on Underserved Populations, itself indicates the importance that we're having about vulnerable populations and the need to really bolster community as well as individual resiliency in terms of the multiple threats, particularly presented by chemical toxicants. So the committee opinion, which Susan presented briefly today, basically gets out a charge and provides a framework for clinical practice in dealing with environmental chemicals. This is not a political thing. This is very much integrated into health practice and should be integrated into health practice. So what follows from this is the fact that the informed clinician could then obviously impart information to their patients about these things. What do you look for in your house? What type of exposures do you have from multiple possible contaminants? And we've developed at the UCSF program on reproductive health and the environment, for example, a number of materials that are germane not only for the patients but for their doctors, so they become educated on how to talk to their patients, and in so doing, become informed themselves to operate at multiple levels of engagement. Some examples, which are in the other room, for example, toxic matters and the low literacy Cuestiones de Salud that are aimed to inform patients so they can go home and look what's under the sink. If work matters, if they're working around pesticides or their spouse is tracking the stuff at home, into their homes, and as well food matters and pesticide matters. All of these are a whole range of important information that flow and supplement the committee, flow from and supplement the committee opinion. And so now, for example, in our Department of OBGYN, a woman who has her first, expectant baby visit gets a PDF as part of the medical record that has this information, so she could take this stuff home and be able to protect herself and the baby that's coming. So we have the level that's afforded of giving better information to our patients, but we have to also look at the other side of this. I think Emma, for example, spoke earlier about the real importance of an informed community and the fact that the expectant mother can be armed with this information, actually potentially can involve her in getting involved with the policy changes that we all need. Turning again to the clinician, a similar process. If we can, and we hope we'll be carrying out this work over the next period, begin to have inroads because of this important statement coming from the American College to organize the OBGYN community, we can hopefully get them involved not only in terms of being better physicians, in terms of what they're imparting to their patients, but to get them involved in multiple levels of operating to deal with the upstream type of problems. One example that I would give is the institutional involvement. Many of you know about the work of Healthcare Without Harm, the related work of the Healthier Hospitals Initiative. There are multiple areas where physicians and other health providers can work that can have a profound difference in terms of energy use, the use of toxic materials, developing a healthy food system within hospitals that could be a model for the food deserts outside, developing food markets, farmers markets, et cetera. I would close on one important issue, was in addition to the institutional efforts, which are extremely important, we have the involvement of policy. So an informed physician, and we have experience about this in the California Medical Association, can get involved in their professional associations and actually make major policy change. And we have examples of this with partners with our local representatives from AAP and ACOG in developing multiple policies within the California Medical Association that protect farm workers from pesticides, have important health chemical policy to deal with climate change issues, for example. And all of these efforts, and I would also salute the efforts of Oregon and Washington PSR chapters and their work with local medical associations, eventually led to these policies moving up to the American Medical Association, whereby the American Medical Association now has very strong chemical policy that we could utilize to make the sort of changes at the national level and be able to incorporate the health professional voice, to, again, move it beyond politics to basic public health. I'll stop there.
Okay, great. Thank you so much. Lori?
My honor. Yeah. That's why I don't need that, I don't think. Thank you all for inviting me here. As much as I would love to take credit for single-handedly making Washington State a leader on chemical policy, you all know that is not true. Everybody knows it takes a huge amount of effort and many, many people in order to pass a piece of legislation, not only at the state level, but at the federal level. And really what we're doing is building an environmental health movement. Many of you I've worked with over the years and called you, everyone from Rachel Kohler, who will regularly, speak to the cameras about her concerns about her child being exposed to toxic chemicals, to Dr. Ted Shetler answering questions about bisphenol A and hormone disruption. There's so many people who play a role, and it's so critically important, and I'll tell you why. Because we couldn't really take action without really courageous people in this room and all over the country to curb the use of toxic chemicals in products. I've been doing this for about 20 years, both in New York State and Washington State, and our organization has led the efforts in Washington to pass a number of pieces of legislation. We're probably the only toxics organization that only focuses on toxics. There's a lot of organizations that focus on the environment, but we solely do toxics. So we've led these efforts. We've established the first in the nation program to phase out PBT chemicals, and that's what Holly is going to talk about, which was a huge success and is continuing today. We passed bans on bisphenol A in baby bottles, sippy cups, and sports bottles. How many people have heard of that one? I think that's mostly the one that people know about out in the world. We passed the first ban on PBDE flame retardants in certain products in the home, and now I'm proud to say that we're actually starting to see declines in PBDEs in Puget Sound. Very early information, but we're seeing results, and that ban was passed in 2007. And then most recently, we passed a law in 2008 to ban lead, cadmium, and phthalates in children's products, but even more importantly, to establish a reporting system that requires children's products manufacturers to start reporting if they're using a chemical of high concern for children, and there are about 66 of them on a list that manufacturers are starting to report to. And we're starting to see a huge amount of data come in on where chemicals are in the material supply chain, from phthalates in plastics still to antimony trioxide used as a flame retardant in children's products. So all of these laws have been not only our strategy in order to protect the people of Washington State from these harmful chemicals, but also then to have these policies passed in other states and ultimately to reform the federal chemical policy, because we know that the system is badly broken and not protecting any of us or our children or our families from harmful chemicals. So that's been our approach, and we've been somewhat successful in terms of where we've gotten to. We do have a bill in Congress moving forward that has bipartisan support. The problem is it's a very inadequate bill, and we can't accept it as it is, so we're working with our coalitions to improve that bill. But in Washington State, we've worked very closely with a strong coalition of the Washington State Nurses Association, so all of you nurses out there, thank you. Physicians for Social Responsibility, the American Academy of Pediatrics, Washington State chapter, the firefighters, and many other organizations that have come together in order to put in place protections on harmful chemicals and to protect kids and our families. And it's been, it's not an easy strategy to pursue, just so you all know. From Schoolhouse Rock, it doesn't work that way. You know, it doesn't go from bill introduced to passing in the House to passing in the Senate to being signed by the governor. That doesn't happen. You know, from the time it is introduced, we are bombarded by opposition from the chemical industry that we know is spending tens of millions of dollars nationwide to stop our efforts. And we know that the Association of Washington Business is opposing us, and they're unraveling us every day. And that's why it's so important for us to engage our experts, our doctors, our nurses, our state government officials, our local government officials, and in this fight to protect kids. And there's so many opportunities, from meeting with your legislator, which is not scary whatsoever, to writing letters to the editor, to working with us on science, and we can use all of that help. And our coalition partners are great and also bring in people that can help the effort. So I just want to say that in order to create the action, all of us, it's not me at all. So thank you for letting me be here.
Next is Tony.
All right, thank you. So I would have to say to begin with that in my work as a nurse practitioner, family nurse practitioner, that the introduction was we're doing amazing things. Well, I don't know if what I'm doing is amazing, but as far as a program or anything like that, but it's important. And so I have been actually overwhelmed sitting here today and listening to everything that is going on to update the information about chemicals in our environment and the impact on health, on children's health, on our population health, community health. And taking that, that I'm here to take that back and to incorporate that into more of my work. And just to share a little bit about my work, I had been a public health nurse for 10 years, went back to school, became a family nurse practitioner, worked for 10 years in our rural community clinic on Whidbey Island, and then more recently have created my own practice called Women to Wellness. And so I basically see mostly women and see women across the lifespan starting at 14 on. And so when it comes, so I guess I'm in the trenches, it's like, again, overwhelmed by all this information that's here. And maybe it's because I live in a rural area, but I don't have, for example, a number of colleagues that are in my medical community that have an interest or are talking about this. And frankly, I have been, over the last 10 years, probably the one that has had the most voice about chemicals in the environment and toxins and concern for health population. And so I feel like there is a huge deficit between the information that's out there and how are we actually getting that to our patients. And I certainly think that we can do a much better job with that. But I think what's important about what I do, and again, I don't feel like I'm doing anything amazing in that regard, but I think what's important is starting the conversation, having the conversation about toxins in our environment and impact on our health, and especially preconception and prenatal. And being consistent with that. And then also, I know what's important within that conversation is to be able to share resources. It's like, if you're going to talk about the concerns for toxins in the environment, impact on our health, then we have to be able to give people resources. And so I also feel that it's important to be able to have the time to really delve in and understand, well, what are the lifestyle choices of this person, and so to help them understand what their potential for impact for exposure to toxins are, and then how to help them with behavior change so that they can make changes and give them more control about living in a safer environment. What I have found is that especially the importance of providing resources is really probably the most important thing after you start the conversation, because people do get scared with this information, and they get overwhelmed with this information. And in my practice in primary care, I see a lot of women with depression, a lot of women with anxiety, and when they walk out the door, I want them to have some tools. And it's like it's like we have handouts and PDFs and great online resources. But that one-on-one communication and being able to sit and to talk with people and answer their questions and know who they are and help them with making better lifestyle choices, I think is a really important place to start. And I wish it was happening more in primary care and maybe happening more in pediatrics. Hopefully it will, the conversation will pick up with OBGYNs. But I think we need to do a lot of work and get that information out.
Okay, great, thank you. Peggy?
Hi, so I talked a little earlier about some chemical policy outcomes, so I'll talk a little more this time about air toxics, since that's such a big issue in urban environments, especially in New York. But in order to engage community residents in environmental decision-making, what we started doing many, many years ago was to develop an environmental health leadership training program for community residents. And we modeled the training program on Columbia University's compulsory environmental science, their basic environmental science course. And so we were able to break down the concepts and develop a 6-week training program that focused on children's environmental health, lead and asthma, air quality, water quality, and that was in the early days. And so now we've updated it to include endocrine disruptors, other issues of obesity, and what more we know much more now about prenatal outcomes that impact asthma. So we've really begun to update those courses. We've been able to train over 200 residents so far. Sometimes we've even had high school teachers bringing their classes with them. We've had a few elected officials as well. And what we realized was that we were training people and we didn't have an outcome for them other than their education. And so what we've been able to do at this point is to find ways to incorporate and engage them into starting their own campaign in their community and engaged in the broader campaigns that we're involved in. I think we all understand that it's not really learning unless people know how to apply their knowledge to on-the-ground action and work. And so that's what we've been able to do with our new environmental health leadership and justice training. Another key initiative in New York City, and many of you have heard about Mayor Bloomberg's Plan YC, which is a strategy, something like 122 strategies for reducing carbon as well as other air toxics. And one of the key initiatives that's happening right now is called Clean Heat. And what we found in New York City, and perhaps in other urban areas as well, is that 80% of the contributors to greenhouse gases in New York City are coming from buildings. And so we were able to detect this because New York City decided through their Plan YC program to develop air monitoring in 160 neighborhoods. I believe it's the broadest air monitoring network in the country. And so by monitoring for the last probably 4 to 5 years, all of these neighborhoods, we were able to see that in the winter, there were very high levels of toxins and pollutants coming from certain neighborhoods that were unexpected, like Park Avenue. And we realized it was because people were burning the dirtiest heating oil, which is number 6. And so now there's a new city law to get, so that when boilers have to come up for a new permit, they will have to convert to using cleaner fuel like number 4, number 2, or perhaps even natural gas, which of course has become an issue with fracking. So we have hired an organizer to begin to work with tenants about the impact of air quality and air toxins on their health and on their children's health, and so that they can provide some impetus to the owners and managers to convert a lot sooner and earlier. And so we're developing workshops for those housing managers and owners. As a result of being a little more involved in the housing impacts, we are working with Columbia to next fall develop a very broad-based indoor air quality and housing conference where we're going to work to bring together very untraditional allies. Some of the affordable housing developers, tenant, we have a lot of large tenant and affordable housing associations in New York City, as well as academics and researchers working on environmental health. So we are really going to try to start a conversation that we really haven't had in the city around building codes and code violations that impact environmental health, and begin to develop an action agenda with some policy outcomes.
Cool. Okay, great. And Corey?
So Amy, I'm definitely going to need the 5-minute marker.
I'm here for you.
I am not known for nutshell talks. And you know, I actually had planned on speaking to a few different topics, but after hearing all of the speakers today, I have come up with something a little bit different that I hope still addresses what Shay asked me to speak to. I was so thrilled and excited to hear just about every speaker talking about stress and systemic connections that we all share. So as Heather mentioned, I'm a psychotherapist. I work with women and couples in the transition to parenthood and babies also. And also the flip side, the balance for me is starting revolutions. I started 2 national campaigns that now in 7 years I think have reached about 5 million people in person, and we've distributed about $4 million worth of healthier goodies during the holidays. And when I look back at effective action that's taken either on the intimate level or in a broader level, for me it all comes down to really one thing, and that is relationships and the human connection. And in today's information that was shared, I just thought this is an action that we can all take right now in our work, no matter what it is that we do. Whether we work with women directly, whether we are affecting policy, whether we are inspiring people to eat organic every day, like my friend Dennis. No matter what it is that we're doing, we can improve our own jobs. We can take care of ourselves so that we can continue to take care of others by remembering that we're part of a network. And when I saw this picture, which I actually scribbled all over because I was like, oh my gosh, this is exactly what I talk to people about, I looked at this, and at first I wasn't sure what it was, and then Margot, I think you shared This Is Us. But when I look at this, I also see this could be a womb, this could be a cell, this could be a family. It could really be anything because we're all systems. And we're supposed to be different, and we're supposed to have different strengths. We're supposed to need different things from each other, and we bring something different to the conversation. So I was hoping that you would be open to doing a little exercise just on this, because I'm hoping that you can walk away with a way to integrate connection into your practice, no matter what it is that you do. Just give yourself a number 1 to 5 of how you're feeling right now. Pick something specific, like it's after lunch, I'm feeling kind of tired, or I'm feeling kind of stressed out right now, kind of overwhelmed by everything. Just give yourself a number there. And now I'd like to invite you to close your eyes for a minute, if you will. And I want you to picture someone that you love deeply in your mind. And I want you to imagine that you are looking in that person's eyes. Just gaze into their eyes. And pay attention to what comes up for you while you're looking in their eyes. Now go ahead and open your eyes. I saw a lot of this, which is what we'd expect to see, so. Like that, right? Now, if you're willing, some of you may not be comfortable with this, and it's totally fine. I always invite people to do what they're comfortable with. Turn to a neighbor and look in their eyes for a moment. Just take a second and look in their eyes. Okay, all right. Now turning back to the front of the room. See, it's fun. It gets people engaged and talking and smiling, laughing, connecting. Now, one more thing. I'd like for all of us to take a few deep breaths through our nose, not our mouths. A breathwork practitioner said, you only want to breathe through your mouth as often as you eat through your nose. So take some deep breaths just through your nose here. Only as far as comfortable. And now take an assessment again of your number, of how you feel now in that number. I'm guessing that your number was improved. If you were already at a 5, feeling super peaceful and happy, maybe you're at a 6. If you were feeling a little bit tired, you may be feeling just a little bit more energized. Connecting with human beings, allowing mothers to connect with their babies. If you're listening to someone, you're a good friend. You mentioned resources, Tony. For us to sit across from another human being and say that we are breath, we are a system, we take in, you listen to me, and then I'll share information with you, is not only productive and efficient to creating this whole. We don't have to do it all by ourselves. But it's also very healing, because when we look in someone's eyes, our stress level actually goes down. And we learned today, I was so excited to hear so much talk about this, because we can't control everything at all. I mean, it's totally overwhelming, but we can do something in an individual moment to let somebody feel seen and be heard and to reduce stress. And we can say, we're not perfect, I don't have the answers. We can be a role model for, I'm doing the best I can, I'm gonna share with you what I know in this moment. And you as a mom or as a parent can do the same thing. That's all that we can do, or with policy, or with research, or whatever it is. So I would just encourage you to take a look at how reducing stress through connecting with each other can create better outcomes for us all. I think I'll end there.
I gave you some extra time.
Did you? Thanks, Amy. Thank you. Although it only feeds my problem. So I really should have been cut off there. Good. I'm glad.
So next we have Holly.
So I'm not used to that being mic'd. As Heather said, I work for Ecology, which is the state environmental agency, and reducing toxic threats is one of our priorities. We've been trying to work on prevention as the smartest, cheapest, and healthiest approach.
So management and cleanup, of course, are still important, and we have a lot of resources that we put into management and cleanup, but trying to put more on prevention, preventing the chemicals from getting into the fish in the first place, rather than telling people how many fish they should eat every week from different water bodies. One of our challenges is non-point sources. People have talked this morning about a lot of the chemicals that we're all exposed to from our everyday products, and we can no longer just permit the pipe, permit the smokestack, and get reductions in our exposures. Lori mentioned a lot of the product laws, and my section enforces a lot of those laws. And I'm not going to talk about what Lori talked about, except for the PBTs that we work on. So those are persistent bioaccumulative toxic chemicals. Ecology decided to focus on these a while ago as the worst of the worst, because they persist and because they build up. These are chemicals we don't want out there, because then they become a big cleanup problem, and because we have exposures for decades. The PBTs, they cross media. Ecology is very siloed. We have water, we have air. We needed something that was going to go across the agency and engage all the programs to try to get solutions. In 2000, we came out with our strategy on PBTs, which then in 2006, we have our PBT rule. And the goal, I love this, it's a big aspirational goal. The goal in the PBT rule is to phase out all PBT uses, releases, and exposures in Washington. So we have, yes. In the rule, we have a list of 27 chemicals or groups of chemicals. A lot of the PBTs have developmental endpoints, and the rule includes consideration of sensitive populations like children and the timing of exposures. We do a lot of the work through chemical action plans, and these are really these broad plans that identifies, characterizes, and evaluates uses and releases of a PBT, and then recommends actions to protect both human health and the environment. So these have the chemistry, the health effects for both humans and wildlife, where we see the chemical in Washington, and where it's coming from. What are the sources? And then given the existing laws and regulations, what options do we have to try to get at this? And these recommendations that we then come up with can be actions that the agency already has authority for, saying that we should do this with our existing authority. Sometimes the recommendation is that the agency should get new authority. We should go to the legislature, get the authority. And a lot of times they're voluntary actions with our partners. The plans come, we work within ecology with people across the different programs and Department of Health, and then we work with an external advisory committee. And this is one of the keys to the success of the program, is we work with a broad group of environmental groups and industry and local government to look at this, to where the chemical comes from and what are the best options, what we can do. We've done, Heather mentioned lead and PAHs. We've also done caps for mercury and the brominated flame retardants. A lot of people have mentioned all these chemicals today, and now working on PCBs. Just to give you examples of some of the actions that have come out of these plans, after the mercury cap, the legislature banned mercury use in a lot of products. We also had a voluntary agreement with dentists to install amalgam separators so that when they take the mercury out of your teeth, it doesn't just go down the drain into the waterways, but gets collected and then can be disposed of safely. As Lori said, we had the first ban on a certain brominated flame retardant to get that out of products. Of course, it takes forever because these are persistent. People always want things immediately. It takes a long time to see positive effects of this. And I was also going to wrap up, my last thing was TSCA reform, because we're just, we're whacking at all these moles, just trying this one, and you need some way of getting at larger systemic, how do we get at using better chemicals in the first place, knowing up front which chemicals shouldn't be put into commerce because they're persistent. Well, I of course think the persistent bioaccumulative ones are the worst, but certain toxic endpoints too. Look at them before they get put into widespread commerce. And we've been testifying in DC on this. to try to get away from this treadmill. And someone mentioned, I guess Ted mentioned green chemistry earlier. Some of you might have seen, we have our green chemistry pocket guides on the table in the other room, working on green chemistry and safer alternatives to help give people tools to move away from these. Thanks.
Thank you. And Susan?
Thanks. I love the diversity on this panel. I mean, Corey was wonderful, and when you were done, I thought, okay, now back to reality. And then Holly is talking about these much larger efforts, and then I'm focusing on really what happens in the exam room between the healthcare provider and the patient. And I wanted to just mention a couple things that can be done at that very small individual level. And one is, I did show that environmental history form that we developed in Chicago. It's on the web. It is it's a one page that goes through what we considered or prioritized as major exposures that can have an effect. Exposures that are relatively easy to decrease. So we do have that environmental history form. So if midwives who commonly have more time with their patients can spend the time going through that, it would be fantastic. But more realistically are the prenatal visits that are 10 minutes long. And so from just to shorten the visit from taking the whole history, then spending a little bit of time on environmental exposures, Sheila Satyanarayana, I know how to say it, Sheila Satyanarayana, who senior authored the paper here in Washington that I was one of the authors on, where we suggested things that can be done in the clinic setting. And we picked 4 topics. And the first one is lead. So we already talked about lead in pregnancy today. The second one is mercury in fish. Then the use of pesticides. And the fourth one is endocrine disruptors. So if I had 10 minutes to spend with a patient, I would quickly go through, a pregnant patient, I would quickly go through her lead exposures. I would ask her about how often she eats fish, and I would encourage her to eat fish twice a week, but stick with a variety of fish. And then I would make sure that she's not doing the spraying pesticides in her home, at least during pregnancy and certainly and hopefully after pregnancy. And then maybe I would spend some time on personal care products. We're now finding that it's perfumes and fingernail polish that are probably worse than others. So I would probably mention fingernail polish and perfumes. Then I don't have the 20 minutes to do the whole history. I had the 10 minutes to go through those 4, but if I only have 1 or 2 things to ask, I would try to get into the electronic health record, one question about lead and 1 question about mercury in fish. And I am actually conducting I'm conducting a study right now with providers who we've recruited in the Great Lakes area who are going to ask their pregnant patients 1 question: do you eat fish? In general, do you eat fish more than twice a week? And then we're going to draw mercury levels to see if that 1 screening question can distinguish between women with high mercury and women who don't have high mercury. It's probably not going to work, but I was really starting with what's more realistic that we can expect prenatal providers to do, and that is ask 1 question. So let's see what we find. We're going to hopefully have 500 women, and we'll be able to make have some conclusions about whether that 1 question worked. If it didn't work, then maybe we'll expand to how often do you eat it, or are these particular species ones that you focus on. I'm also working with the Asian community in Chicago because we know that because of fish consumption practices, Asians often have higher mercury levels. And we found that at 2 health fairs in Chicago a year ago. We took hair levels at 2 health fairs held by 2 different community organizations catering to the Asian population in Chicago, and 28% of them had elevated mercury levels. So we kind of corroborated other research showing that the Asian population, not because of anything else except for frequency of fish consumption, have higher mercury levels. So we're going to start focusing on those particular communities as communities at risk for mercury. So if there's something for providers who are catering to Asian population, for them to focus on, it would be fish. And I love the Department of Health Washington, State of Washington. I love their palm card, the wallet card on fish. And I love this, the City of New York has an awesome brochure. And I have screenshots of both of those that I show in Mercury talks that I give around our PESU 6-state region.
Cool, wonderful. All right, so at candidate forums where they ask a question, everybody has to do lightning round. So not now. I'm gonna ask you guys the question. You can think about it, and then we're gonna go to some audience questions. But if you could wave the magic wand and you could fix the biggest barrier that you're facing, other than the ones you've mentioned, like the American Chemistry Council or money.
That's my answer.
That's why I'm not saying that. Anyway, so the biggest barriers, if you could really, it would make you really successful. You could really succeed in your actions that you guys do. What would that be? And so think about that, and then let's go to some audience questions. Do you want to take a mics around? Okay, does anyone have any questions for our panelists?
Here it comes.
My name's Jane Palmer, and I work at North Central Public Health District in the state of Oregon. However, I am a Washingtonian. I was really, really interested in the discussion about training basically people within the context of community to sort of be the mouthpiece and, thinking about popular education as a venue for really engaging people of the community to be the voice to the community. Is the curriculum that you mentioned available?
We don't have it online, but we're right now updating it, so it will be available. We have some of the old modules available.
We should add that to our resource list, which is in the back of your program, and we could send that out through the our listserv too, which will tell you about how to get involved with that.
Okay, any other questions from the audience?
Anyone?
All right, we'll start our lightning round, and then I have more questions after that. So Tony.
Yes. I'm looking at barriers.
Barriers that if you could overcome to be successful in taking action, so this is an action panel, what would you wave the magic wand and address?
Education. I mean, in the clinic, and that would relate mostly to my time and being able to then take quick information and share that with patients.
Great, cool. Bob?
I think education is key. Obviously, I was focusing, in this case, on the education of the health professionals as having a very important role, both within determining the sort of, how we interact with our patients, how we work in our institutions, and how we act at the policy level. Each one of these things, in terms of health professionals, is trying to activate what I think we all recognize as an important voice for change because of the credibility of health professionals. I just think the real challenge is that we're facing is the realities of medical practice. There's very little time. Most health practitioners are very challenged by the current crisis in health delivery. So we have to find a way to be able to activate that voice in a way that is cognizant of that. And that's why I think we've certainly in the San Francisco area and a number of our PSR chapters have worked for many years within the Healthcare Without Harm framework, because that's where people work, and if they get a sense that I think has been shown that you can make real change even at the institution level, because institutions use up so much energy, use so much toxic materials, et cetera, you begin to make it easier for people to go out on the limb and take the next step, which ultimately we would want to see as policy change and be able to affect chemical policy change in particular.
Cool. Lori?
Okay, aside from eliminating the chemical industry, I mean, I think that we know the equation to win. I mean, it includes the truth. All we have is the truth, the scientific truth, and then we have people that then move legislatures or Congress to act. And so if I could wave my wand, I would start a march with all of us today. We'd go on I-5 and then thousands of people would join us. We'd stop in Olympia and not leave until the legislature passed the Toxic Free Kids and Families Act, which is going to deal with more toxic flame retardants than we've ever dealt with before. And then we'd go to Washington. But it's honestly, it is people and creating that movement that's ultimately going to overcome that barrier that we have, which is great, which is money and influence at very high levels.
Peggy? I'd say campaign finance reform.
Yeah.
Yeah. Yeah, I mean, we've got to have, especially at our state houses, and we have it at our city council, but at the state level and federal level, taking big money out of politics will make a difference. We'll have a better chance of having our voices really heard. It will also have a more diverse set of elected officials who aren't there for 20 and 30 years and having to be carried out, in their memorial service. I mean, they have to pretty much be carried out. They don't retire. So, I think that would make a really big difference for all of us.
Cool. Court?
Well, as a type A, I would like to say that the biggest barrier, not enough hours in the day, not a way to clone, all those kinds of things. But I think that while there are a tremendous amount of barriers, there are also tremendous possibilities that have yet to be explored and tapped into. And our story is not done. I mean, we're just part of the story right now. It's still unfolding. We don't know half of what, not even half, we don't even have the tip of the iceberg of what we're going to know tomorrow and the next day and the next day after that. And when I try to wave my magic wand in my mind to go to where I'd want to affect action, I go back generations, because as we heard today, it just goes back that far. There's no way to kind of start the circle. But I think at the same time that you guys have seen the bumper sticker, Peace on Earth begins at birth, something to that effect, that the seeds of compassion for the planet, for our communities, for each other, begins at the earliest time of life. So that whenever that is in the cycle, if we can, I think our biggest barrier is that we aren't necessarily focused enough on just infusing our little vulnerable human beings with the capacity to care enough to take us through whatever it is that part of the story is.
Cool. Holly?
The first thing that came to mind for me was TSCA. That it keeps going back to TSCA reform, that if we knew anything about all these chemicals that are coming out every year, why don't companies have to know anything about the toxicity? There's no mandatory testing. So we don't even know how to find these in the environment, because there's nothing anyway, so that should be done up front. So at least we have some tools to figure out which chemicals should be out and how to deal with them, and when to be concerned and when not to be concerned. Mm-hmm. And that's not in any of the bills that's floating around. But
Yeah. I think he's got it on. Okay. Yeah. You're getting the final word. I know, the final word. I'm going to echo the two other clinicians on the panel, Tony and Bob, and say more time in the exam room. That was my first response. More time between the healthcare provider and the individual in the exam room. And then if I had a very large magic wand, it would be TSCA reform, regulatory reform.
All right, well, let's
talking
our panelists. Oh, one more, sorry.
I wanted to ask one more question. I would just ask Margot permission too, but so, and Susan, I'm going to pose this to you. Sure. There's been all this wonderful talk about the American College of Obstetricians and Gynecologists and their statement, so fantastic, and yet I would say one of the greatest barriers is the obstetricians and gynecologists, is that the majority of women, even very well-educated women and women of means, who walk into their doctor's office who say, I'm pregnant, and now I know, right? And they've got their list, and we talked about the stress that can be associated with that list. I shouldn't eat fish, and I shouldn't use this. But the majority of their doctors say to them, that's a lot of voodoo science, there's not a lot of that. A lot of them don't know anything about personal care products. What do you think about getting, I mean, and they would be one of the most powerful sets of people walking down the road to Olympia. They said, this is making people sick. They're one of the most trusted populations out there in America. How do we get to our doctors to where many of our nurses already are?
Yeah, I think you've hit the nail on the head, and now I think we're recognizing that is the issue. Yes. The answer is yes, that's the issue. And so the couple things that we've been doing, this group at UCSF really spearheaded this ACOG statement. So I mean, I can't emphasize how important this committee opinion was, that the big OB groups finally said, oh, okay, this is an issue. So that's step number one. In our working group, we do have a working group that has talked about what we can do, and one is getting into medical school curricula, getting questions on environmental health on the boards. If you want to be a board-certified obstetrician, you need to be able to answer these questions, and there's nothing that gets their attention like, board certification questions. The folks in California have also started working on a rotation for our fellows. OB residents can go rotate, do a month rotation on an environmental health kind of academic rotation. So we are thinking about it, and we're just starting. One of the other really exciting things is the PACEs are very well established. These groups of clinicians and toxicologists that receive federal funding in each federal region to do children's environmental health. And what we would really like to do is be able to add an obstetrician to the group. Now we get this teeny little bit of funding that buys a small portion of each of our FTEs. But if we're looking for more funding if we could get an OB in each one of those groups, then at least in each federal region there would be somewhere for the pregnancy community to go. Those are some thoughts off the top of my head, but you raised obviously a very key question.
Can we thank our panelists one more time? Okay, whoa.
So as the panelists are making their way off the stage, I release you. You're welcome. You know how in the beginning of the day, it might have seemed like a long time ago, but it wasn't really that long. I said that we were going to ask you to do some work. I didn't mention it was going to be at 2:15 when everyone's like, I need a cup of coffee. You will get your coffee. You will get your treats. You will get more prizes. I promise. But before you do that, I would like everyone to take out this piece of paper. This says script for action and results. Now, I might seem a little bossy, but really I'm a nice person, and I'm not that bossy, so I'm not going to make you do anything that you're uncomfortable with. By the way, can I just tell a story about when Corey was doing when Corey was taking us through that exercise? So I immediately thought of my husband. I'm like, I love you, honey. I think I do. I mean, it's been a long time. Sometimes you drive me nuts, but I do. I love you. And then I was like, well, I really love my kids. They're so cute, But then I was like, but she told me to think of one person. So I'm going back in my head between these three people that I love so much. I didn't want to be a bad mom and choose one over the other. And even that beautiful exercise, it was like, I was feeling really good. It stressed me out a little bit, Corey. You and I need to sit down and we need to get together. We need to get together. Okay, so as you guys are taking out your script for action and results, again, I just want to give you the opportunity to do some writing, jot down your thoughts, turn to your neighbor and say to them, here is an issue I want to address in my community, in my work. This work is important to me because, fill in the blank. The key near-term actions I am planning to take to generate results in my community and in my networks are 1, 2, 3, 4, 5, 6, however many you have. And here are the resources, people I've met today, contacts and information I can use to help me. And list those out. I want you to write them down, and we're going to have a moment to share them after you write them with someone at your table. I'll give you a few minutes to do that. And then come the prizes for people who are willing to share some thoughts. And Amy?
What I want to say, one other thing I want to say to you, I know there's a few of you in this room. I'm sure it's a terribly small minority, but they're looking at the clock and you're thinking, there's traffic, it's kind of cold, I want to get home. I want to tell you why not to leave. Not only will we remember who you are, you know who you are, but we have left for last this fascinating, quick and dirty, what do you need to know? Is your cell phone poisoning your brain? Is obesity issues related to Margot's chocolate, or is it something beyond your control and your personal care products? We are going to give you the quick and dirty latest science on each of those things and anything else you may want to know. Fukushima, these things are going to be answered in the last panel. Do not leave. Do not leave. You will be sorry to miss that.
Okay, thank you guys so much. I can see all of that great writing and energy going in. Now, I want to say the first person, listen carefully, the very first person that gets up and shares their script is going to get a pretty special prize. This person might want to be someone who knows a baby, is maybe having a baby, because it is this beautiful, or needs a baby gift, because it's this beautiful, handmade from a woman in Port Townsend, Kate Golda, and this was donated by her. She makes these beautiful, non-toxic toys and sells them all over the nation, and this is a gorgeous felted mobile that I'm going to steal for myself. My kids are too old for that. That would make a lovely gift. And so the very first person who raises their hand and shares with me some information, you don't have to read the whole thing, of something that you've heard today that has really influenced what you do in your work. Sue, I'm coming for ya.
Hi, I'm Sue Bates. I'm a maternal child health nurse. I work at the Benowa Medical Center, which is in Plummer, Idaho, on the Coeur d'Alene Indian Reservation. One of the things that really excited me today, it may seem simple, but it was the green cleaning products. I plan on introducing that at our next baby fair, which will be in April.
Here you go, Sue. I love it. Pat on the back, Sue. Good job. You know, it's those simple things, and also people love getting stuff. It's such a great educational tool. That's what I'm doing to you right now, giving you things. So anyone else want to share something for their script? Something, maybe you work in maybe you work in local government and you're looking for something new and innovative to introduce into your program. Maybe you're a clinician, or maybe you work in a community health center and you say, how do I get this information about environmental health into my clinic and my patient outreach? Anybody want to share anything from their script? Otherwise, I'm going to have to start calling on you, and don't worry, I will do it. Oh, good. We got a volunteer over here. Wait, let me go back for chocolate. I won't forget you. That's at least as long as I'm pretty easygoing. I'm not going to grade you or anything. Okay, and don't forget to introduce yourself. Thank you.
My name is Denise Frakes, and I'm actually with Blue Sky Services, and we're a cleaning company. Kind of don't really blend here. But in a way, I do, because I'm in homes every day for 23 years. I've been seeing what happens in every home. I've been personally chemically exposed. I get it. So my vision is really to help people decrease their stress and help them understand that they don't have to have that toxic load in their homes, and how to easily minimize their daily practices and how to just change. This is emotional to me because it's personal. I know a lot of people that have cancer and children that are ill that shouldn't be, and it doesn't have to be. So I take it personally. And what can I do? I can write more. I can get a bigger voice. I talk individually to a lot of people. Anybody who will sit still, I talk to them. But I need a bigger voice so I can reach more people. Emmanuel and I were just talking about that. How can we get this education out to more people? Because doctors don't have enough time. We all have to talk. Everybody has to talk, and we have to talk to each other. And that was part of it, is how can we connect with each other. So I have this little bit that helps you, and you have a little bit that helps you, and connect. And I think that was the biggest thing I learned is reconnecting and not trying to invent the wheel and do it all, but reconnecting, working with other people. So anyway, thank you.
Way to go. Let's all give Denise a round of applause. Thank you so much for sharing. Enjoy your chocolate. I'm moving around. I have more gifts, so don't you guys worry. Anyone else want to share something on their script that they're taking away from today, something that they're committed to engaging, integrating into their own work? Gail, would you like to share something? She does not get chocolate.
For 25 years, I went off chocolate. I went back on it last year, and you are not going to give me chocolate? That is rude. Okay, so I want to talk about one of the programs that I work on as part of my work in local government to reduce exposures to kids. That's my job. And a program that I'm on now that you may not know about, and it's one that you can get involved in too, works with child care providers. People who run daycares, child cares. And if this isn't directly applicable to you in your work, we've got a lot of people here who are parents or grandparents, or you have a neighbor who's got a kid. So what I'm going to tell you is applicable pretty much to anybody. There is a program that is national, actually it's international, called the Eco Healthy Child Care Program. And basically it's a set of recommendations to a child care of things that they can do, practical steps they can take as they run their child care that will reduce toxic exposures to the kids. It also reduces those exposures to anyone else. And if they are an in-home family child care, it's reducing those exposures to them and to their own kids. So it's a checklist of 30 items, and they are some suggested, some required, and it's optional. This is something you can, by the way, this list is perfectly good for your own home. It's my guideline home at my own house. So in our area, I am the contact. So in the Puget Sound area, I am the contact. There are many of these in the side room. Take one and my stickers on there with my name and contact information. If you're saying, yeah, but I'm not in your area, I don't care. Just call me anyway, and I'll either hook you up with someone who can help you in your area, or I'll help you anyway.
Just don't tell her boss. Okay. Oh, yeah. Here you go. Have some nuts. Pistachios, I found. We decided we like her better off the chocolate, if you know what I mean. Okay, so we are at a time for a wee little break, but I wanted to mention a couple of things. I know that it's getting towards the end of the day, but I don't think you want to miss out on the last 2 Portage Bay gift cards. You do not. And also, as Amy said, we're going to have this fantastic panel of things that you never thought. You think you're scared now. Oh, just you wait till you. No, that's really not the point of our conversation here today, but we are going to touch on some issues that are sort of new, upcoming, the EMF issue, Fukushima, some others, obesogens, as Amy mentioned, so you clearly do not want to miss. Please note, before I forget, that there are, again, these green cleaning kits for those of you to come check and see if your name is on one of these pretty kits. And I'm going to putting out this very beautiful bowl at the registration table for evaluation. So if you get those done towards the end of the day, this is going to be there. So take your break, grab some coffee. There's some treats along that wall, and we will be back here starting again in 15 minutes. Thanks so much.